Dr. Rachna Patel has found her niche as an expert in cannabinoid therapies, and she's authored the book, The CBD Solution. Please welcome her to Team Chronicles, Dr. Patel.
Hi there.
Hi, Dr. Patel. Thank you so much for being with us this morning. I want to start out just because I'm personally intrigued to what your career began in emergency medicine and moved into cannabinoid therapies. You're now considered an expert in medical cannabis and CBD oil. What inspired you to change paths, and what led you to this point?
Yeah, so, well, basically in emergency medicine, a lot of what you do is treat pain, right? Our main goal is to rule out any sort of emergent causes. And if there's no emergent cause, then basically you send the patient home on their way with instructions to follow up with typically their primary care doctor. And you also hand them a prescription for pain medications. Typically it's opioids. Now, given the state of our healthcare system, a lot of people end up using the emergency room as their point of primary care. And so a lot of these patients would come back into the emergency room and they typically say one of two things: that the pain medications didn't work, that they were experiencing side effects from the pain medications, or in the worst case of scenarios, I would end up having to resuscitate patients that either intentionally or unintentionally overdosed on these medications. So, I really felt like, like any bright-eyed med school grad, you're in medicine to really impact change, right, in people's lives. And instead, what I felt like was I was standing at a revolving door, right, not really solving a problem. We were just kind of pushing people through, they're coming back, pushing people through, they're coming back. And at the same time, being as sleep deprived as I was one night surfing the internet. Really, truthfully, what I was doing was I was virtually dumpster diving on Craigslist.
I do that too.
Yeah, there's some great finds on there. Because I had this like sparsely furnished apartment, I needed furniture in there. But I happened to click on the I think health and medical section, and there I found an ad that said medical marijuana doctor needed, which piqued my curiosity. So, I kind of got into this rabbit hole for a period of a year, actually, in this whole field of medical marijuana. And what I ended up doing was I dug deep into the research on marijuana and the effects that it had, clinical effects that it had. And by the end of the year, I was very compelled that, there's a lot of potential for this medication to treat chronic pain in a way that conventional medications don't. So at that point, I decided, okay, I'm going to sign up to work at a medical marijuana clinic, and basically responded to one of those ads on Craigslist. Because I had the book knowledge, so to speak, but what I really needed was the people knowledge, right? Because that's what makes a doctor really good at what they do, is not only do they have the book knowledge, but they have the people knowledge as well. So, so I signed up to work at a medical marijuana clinic. This was back in 2012, and here we are in 2021, and there's been no turning back.
Wow, what an interesting story. Thank you so much for sharing that with us. So you know so much, and I love your YouTube video also because you answer all the same type of questions that we get so much. What ailments do you find can be treated with cannabinoid therapy?
Yeah, so the most common conditions that I've ended up treating are anxiety, insomnia, and chronic pain. So those are, who in America doesn't struggle with one of those three conditions? Especially now with the pandemic, the anxiety levels are running pretty high. So those are the most common. And of course, outside of that, there's definitely other conditions as well, right? So for instance, cancer, not necessarily for, treating or curing cancer, but we're talking about the sequela of cancer, right? So someone can have chemo-induced pain. Someone can have poor appetite. Someone can have nausea and vomiting. I've also treated children with autism as well. Alzheimer's is another one. So a variety of conditions for which this one medication is applicable.
It seems that CBD oil or CBD therapy is good for so many disorders and syndromes. Is there anything that it is absolutely not good for, or any type of person that you would say, this is really not for you?
Yeah, so I've had some patients come to me looking to treat, for instance, high blood pressure with cannabinoids. And it just doesn't make an impact on blood pressure at all. So I would say overall heart conditions, if you have any sort like I've had another patient that came in about who recently had a cardiac arrest, and whenever your heart goes through an attack, it leads to some tissue damage that then has to repair itself. So in that situation, I advise the patient, why don't you come back in another 6 to 9 months once the tissue has had a chance to heal. So there's different sort of cases that come up, but I would say, heart issues, lung issues, certain types of psychiatric issues as well, because cannabinoids can certainly exacerbate those conditions. So when it comes to psychiatric issues, we're talking about someone who's had a history of psychotic episodes, for instance. Excess amounts of THC has been shown to exacerbate episodes of psychoses. Women who are pregnant, who are breastfeeding, or who are planning to become pregnant, I err on the side of caution just because the data is limited. And some of the data that we do have, though biased, it does point in the direction that, a cannabinoid use during pregnancy could potentially lead to low birth weight or preterm labor and delivery. So, that, and then in children, you definitely want to be cautious there, especially when it comes to dosing.
In your book, in part 5 of your book, you talk about using CBD in recipes and drinks and desserts. Is there a benefit to adding CBD to these items?
Yeah, so one thing in medicine that we always deal with is non-compliance, right? So that's basically when patients don't adhere to their medication regimen. And one of the ways to make that easier is to make the medication more palatable, right? So you mix it in with some sort of food. Now, the added advantage of mixing in cannabinoids with food is that when they're taken with something heavy in fat, it makes for better absorption of the cannabinoids. So those are there's sort of a twofold benefit to adding your dose of cannabinoids to, whatever food item it is that you're consuming.
Do you have a simple recipe or just a recipe that you suggest a lot that you think our community and clients might enjoy?
I'm not much of a chef. We actually had a chef create those recipes in the book.
Oh, you did? Okay.
Yeah, it's really funny because my cousins bought the book and they read through it and they're like, there are these like nuanced recipes in there. We didn't know you cook, right? And they've witnessed my disasters. They've tasted my disasters. And I'm like, no. There was a chef who was hired to create those recipes. There wasn't me. But simple, like I said, that, cannabinoids are better absorbed when they're taken with something heavy in fats, right? So I always recommend something as simple as, mixing your cannabinoids with like a serving of guacamole, for instance, right?
Oh my goodness, that sounds so good.
Yeah, or just mixing it up with some olive oil, and then you dip some like bread in there. So as long as there's something heavy in fat, right? So if you're making like a chai, there's a recipe in the book for a turmeric chai, and you can make that with half and half, for instance, because there's a lot of fat in there. So that's, you know, those are some general guidelines when it comes to mixing cannabinoids with foods.
Certainly. And many CBD products come already in a carrier oil. Would you suggest to mix those with another, let's say in your guacamole, or is the carrier oil sufficient?
I would say mix it with something heavy in fats, for sure.
Okay.
Yeah.
All right. Wonderful. Is a lot of people call about the differences between CBD and THC. Uh, what can you tell us about those two cannabinoids?
Yeah, sure. So the main difference between CBD and THC is that one is psychoactive and the other one is not, right? So THC is psychoactive, CBD is not psychoactive. But really, their ultimate difference comes down to the medical effects that they have. Okay. So I would say 80% of conditions are benefited by CBD, and about 20% or so are benefited by THC. So the most common conditions that are benefited by CBD include migraines and headaches, muscle pain, mild to moderate nerve pain, anxiety, and insomnia. And then you do need some amount of THC to help with, for instance, like nausea and vomiting, autoimmune conditions. So, and also when you have severe nerve pain as well. So it's nuanced in terms of what you need and what amount you need based on whatever symptoms it is that you're experiencing.
When it comes to THC, what are some of the administration methods that you suggest?
So administration methods will vary depending on, again, the symptoms and the conditions that the patient is experiencing, right? So let me just give you an example. For instance, if someone has anxiety, topical is not going to be of benefit to them. But if someone has like arthritic pain, for instance, and it's say like a localized single joint on a finger or something like that, then they will benefit from, you know, from a topical, for instance. So it's very individualized. If we take migraines, for someone who has migraines on a very regular basis, then, you know, they may need to take edibles or tinctures on a regular basis. But for someone who has migraines, you know, every once in a while, then, you know, they could get away with using like a vape pen on an as needed basis.
Is smoking ever appropriate?
I never advocate for smoking just because based on the research, there are carcinogens that are being released just by the nature of burning something, you know, whether it's the paper or, you know, any sort of potential pesticides in the plant material that could create carcinogenic byproducts. So I'm never an advocate of smoking. It can lead, it's shown to lead to long-term inflammation. You know, it can make you more prone to like bronchitis, for instance. So, yeah, I'm not an advocate of smoking cannabis.
Excellent, thank you. For any of our clients or communities that would like to know more, do you see patients from all over the nation, or how can people find out more?
Yeah, so I actually see people all over the world. I do consults. They're consults on an educational and informational basis only, but you know, I am going through and walking through you know, what your medical history is, and then based off of that, you know, we're figuring out a plan of action when it comes to cannabinoids and, you know, specific conditions and symptomatology that the person is you know, dealing with. So yeah, all over the world.
Fantastic. Is there anything else? I know that people can also follow you on YouTube. You've got your book out, the CBD Solution. Anything else I'm missing?
No, other than that, I do a lot of education. I educate other medical professionals because now it's getting to a point where patients are asking them questions. And because this is not something that we're educated about in medical school, I am, going out there making the effort to educate them. So those are some of the different things that I'm currently involved in. But yeah, if your viewers have questions, they can feel free to post them on my YouTube channel. And I am going to start answering questions again, like I did in the past. I took a little bit of a sabbatical from it, but I'm getting back on it.
Fantastic. Thank you so much for being with us today. It's been a pleasure meeting you and learning more about the service that you provide.
Yeah, absolutely. Thank you for having me. I appreciate it.
It's our pleasure. Thank you for joining us in Care Team Chronicles. We'll see you next week.